Yes, yes,
I am always with you and with all the
yes.
people in this wonderful Congress and a wonderful meeting. Okay, thank you so much for your invitation, and thank you so much all everybody who are there. Okay, I will do today my presentation first, and after that I will present a video of one of my colleagues of my school, who is a physiotherapist, who is Dr. Felice, who is sick. He cannot stay with that, but he sent to us a video, and after me, I will share the video for all of you. Okay. In the presentation, we will talk today something. Let me share my screen and share my screen with the presentation, and we will start. The topic of today is, I think it's a nice topic because it's regarding the posturometer. Posturometer is how we can measure our treatments, our therapies, and how we can do diagnosis in that way. I will start the presentation of the posturometer as you know, posturometer is an instrument, is an objective instrument that allow all medical sciences to measure. Before start the presentation, I want to introduce something regarding posturometry, because posturometry is a very complicated science, and it's very difficult in just 5 minutes to explain. But I will try to do that in a very simple way. The many years ago, Galileo Galilei, I think every all know him. He said that pur si muove, but because he cannot prove that the earth is going around the sun. And we said that everything that is scientific, it is measurable. And with the posturometer, we can do that. We use the posturometer for different fields, from the research, the diagnosis, the clinical projection of the therapies, and the following our therapies. It's one fantastic instrument that help all medical sciences to work better. If I ask every one of you, what do this person have in common? I will have a lot of answers. Maybe the posture, maybe the position, maybe the planes, a lot of things. But the only answer is that these subjects are searching the best possible body center. And I am trying to explain that just to you understand the posturometer, because the posturometer measures that also. We always found the best body center of our body. The objective is to maintain as close possible to ideal center of gravity. Why? Because in that position we save energy. Our body, our brain, our central nervous system try every single minute of our life to save energy. And that is why this is a normal situation. That is why sometimes we start with the diseases, because to obtain that very center, we adapt the body. And sometimes the adaptation of this body is not good. We try to have a constant balance in all situations. Every person is trying to have a constant balance in the whole situations, and that is the thing that our central nervous system work. The ideal center of gravity is obtained only if we have a perfect balance between afferences and efferences. What do I mean? If our receptors, the receptor of our body, they are working very well, we can find that very center perfect. And because here we are rehabilitation people, if we have that, we will have a good balance in the muscle chain. The posturometer, and then we will go deeply into the presentation. The posturometer is the best way to measure the posture, to do diagnosis of the postural imbalance and pathologies, and also to follow our therapies. And that's very important, just to understand if we are going well. That is a good instrument. In our school, in the M.P.R. International School, we said we have 3 diagnoses. The clinical diagnosis, obviously, first. Second, the instrumental diagnosis, and we do that with the posturometer. And third, the complementary analysis, because we have to study the internal body also. Today we will talk of the instrumental analysis in our school. This particular instrument allows us to measure. I cannot explain how we do the measurements. Maybe the next time when we will be there, we can do a good workshop to see how it's work. Posturometer is an objective instrument. Objective means it's not subjective. We cannot influence the instrument, and that's why it's a good diagnosis in clinical. We said in the instrumental diagnosis we do posturometry and stabilometry. Posturometry and stabilometry. Stabilometry is the founding of the body center of our body, and posturometry is the body weight distribution. And with a special protocol, diagnosis protocol in our school, we have that protocol. Next time we will do in presence that practice. This allow us with this special protocol to do a good diagnosis, to project our treatments, where we have to go, but mainly to follow our therapists, because sometimes we don't know if we are going well or not in our therapy, and that is a good instrument for it. Posturometer. Posturometer is working as a concept of Kapanji. You know very well Kapanji. Kapanji study how our body weight is distributed in the floor in 3 areas: the first metatarsus, the 5th metatarsus, and the calcaneus. He studied that, and the instrument measure in that way. Have 3 sensors to send to the PC the information. The PC has a software, and with the software we see what happened, and with our clinical observation we do diagnosis. The 3 ways, and we do 3 measurements. This is the basic protocol. 3 measurements. One of them is where the patient stand up with the open mouth and the eyes open. Without excellent standing there. The second registration is mouth closed and eyes open. And the third registration is with the mouth open and the eyes closed. What are measuring? We measure, what we measure with the three registration. We measure simple, the posture, how it is. We measure the occlusion, we measure how the craniofacial system is disturbing, is affecting the posture, very important because craniofacial system is a big disturber of the posture. And the foot support, one of the main receiver of our tonic postural system. Three simple. After that, we can measure anything we want, as I show you in some graphics. We can measure a lot of things, but this is the basic protocol. The basic protocol in the therapy. And when we're talking about the foot support, the foot support, what we can measure and how it helps us. We have the exam with the open mouth and the eyes open. That means the posture. And then we say to the patient, we study when the mouth is open, because in that way we don't have interferences of the craniofacial system, and with the eyes closed. And we see what happened with the foot support. In that particular graphic is a graphic of stabilometry. In that thing we can see mainly the effect of that particular receiver. On the graphic you see on the right foot, on the left foot. You see when the patient open and close their eyes, on the right the traces are superposes. That means that foot is working well. In the other one, it is not the same, and we can see that this particular foot is not working well, and we have to treat it. If you are a physio, you can do physiotherapy treatment. If you are an osteopath, you can block it. Different kind of treatment. Imagine with an instrument, you can see if this particular foot is working well or not. But we see that the both traces are varus. And when are varus, we said normally in this particular case, we said is an adaptative foot. The patient, we see also we do clinical observation of the foot. We do different observation. Another one is like this. Look at this foot is working absolutely. This working absolutely good, because both are varus and traces are superposes. Varus. But if you can observe, superposition of the traces, and that is very important for us. This receptor is working well. But if you see here, is superposition, but in one trace, the position is going back. That means receptor is not working well, exactly. But all of them are varus. The foot. We see also, we study the monopodalic support, the front or the back. This is clinical. Clinical, we don't do only instrument. We don't do only, it is impossible to do only the instrument observation. We do clinical instrument. And as you see here, another trace. In that case, foot is valgo foot is varus. We call that disharmonic foot. Disharmonic foot is creating also adaptive scoliosis. Imagine an instrument can help you to do diagnosis and help you to the treatment. Look at that, another patient for the foot. The patient is overloading here. And look at in the overload, it's blocking that foot. It's blocking there. When you know how to read the traces, it's a good instrument. Valgus, varus, disharmonic foot is creating adaptive scoliosis also. But also we can study the scares with the instrument. You know, the scares are very, very important in our muscle change, in our therapies. Look at that. How the scare here is creating an instability in the movement. And also here, the graphic, how is losing muscle tone, is creating a lot of difficulties into the tonic postural system. But also we can see, we know that the craniofacial system is a big disturber. And this situation is creating a lot of problems, lateral deviation, eyes, and how is affecting the cervicals, vertical rotation. We see the retroposition of the jaw. We see the yoid situation. We see the cervical alteration, frontal and lateral, the blockage, scoliosis in the cervical, etc., etc. This is clinical. Radiograph and instrument. Look at how when the patient closes the mouth, is increasing the overload. That mouse is creating a lot of problem in the muscle chain. And look at what happened following the therapies. In our school, we deprogram the system with the bed, the body equilibrium device. It's a special silicon therapy. This instrument is an intraoral dispositive for physiotherapists and osteopath also. And look at here, 3 kilos. When we put the correction before and after, 0. We can see also if our instrument is working well. And also we can study the biochemistry. That was a research I did many years ago to study how the effect of the biochemistry in our muscle change. And we can do that with an instrument. Look at here. If we go here, and we test the intolerances. We test the posture first, and we see what was the posture first. We test the onion that person have one cross hypersensitivity, and look at how it starts the variation. And we taste the rice flour that is 2 crosses, and look at here, increasing the overload in the posture. And we tested the chickpea that had a high hypersensitivity, and look at that. With the instrument, we discovered that also. How that particular food is affecting our posture. And with the placebo, no changes. Because in a research, you have to do a double blind. And with therapy, how the situation is better. With diagnosis, and we follow with a single instrument. Craniofacial diagnosis also. We can study the occlusion of the teeth with this instrument. This is the Kapanji areas that we talking before. And look at that. Open mouth, closed mouth. How the craniofacial system is increasing the overload. The craniofacial system is disturbing the posture. And the occlusion any pre-contact in the teeth are creating alteration in the foot. That was a research I did in 1990. How the pre-contacts can alter the foot support. How they can alter. And look at that. Open mouth, close your mouth. Open and close. How is altering this particular situation in the craniofacial system is altering the posture of our body. If you understand, we have a lot of things that we can diagnose and we can treat and we can follow our treatment with a single instrument that is an objective instrument. Look at here how the patient, 6 kilos with the mouth open to the left, and when the patient closes the mouth, how is increasing the overload, and it's increasing the overload also in the calcaneus, and overload, losing weight here and overloading here, and how is also how increasing the overload of the body from 6 to 8. An instrument prove that the negative effect of the craniofacial system into the posture. And that is the thing I want to point it. The rehabilitation have to take care in all of these things. The eyes, the biochemistry, the craniofacial system, the diagnosis, etc., to have a good result in the physical rehabilitation. And this instrument, look at that, increasing to the left. And I understood in my years of practicing, these 47 years, that it's very important to have a good protocol in diagnosis and also in therapy. And it's very important. In M.P.R. we have it. We have it's a protocol for the whole medical sciences. This is the things we teach in our school. And after we teach, obviously, treatments and other things. But the main thing is to have a good diagnosis in the same concept, in the same language, and it's a good protocol for all medical science. We see the patient in the same way. We see the patient with the same vision, with the same diagnosis, with the same protocol of diagnosis, presentation of the therapy, and therapy. That is the main in our school, the main goal in our school. You have there all my contacts, and we have an application. An application is the M.P.R. application. You have a lot of, it's a free application. You can register there, and it's a free application. You have a lot of information there. If you go there and register, you can in this one. You can go. If you go here, if you click on there and you go to the application, here I am logging in my name. And then in this application you have a community. We can communicate. We have a learning. You have different topics. The M.P.R. TV with a lot of topics in 3 languages. This is and it's free for all of you. You have a lot of information there. And if you want to register, it's good for us. And I hope you enjoy this presentation, and if you have any question before I launch the video of my colleagues of one of the osteopaths in my school, I'd be great to answer the question. If it's not, please, I will, Kevin, if you tell me, I will go to the next presentation, and then they can listen our physiotherapists.
Yes, sir. You can start sharing your
okay.
therapist.
I will stop to share this. Yeah, okay, and let me
Yes.
let me
Any questions? Yeah. Any questions to Dr. Silverio? Any questions? You have the question, sir? No. No, it's fine, sir.
Okay, okay. I will share the presentation, and then I will give the opportunity for the other speakers to talk. Yeah, let me 1 second, because I have to open. I have to send the recorder. Let me share the video. Wait a minute. Okay, and I leave the video running, and you tell me, please, Kevin, if the video is working well, because I am not allowed to see that. Let me 1 second.
Yes, sir. You can start sharing.
Okay, going here. All right, starting sharing there. Okay. Okay, you see that the video, yes?
Hello, everybody. I'm Giuseppe Felice, massage therapist, postural therapist expert from Italy. And today I will speak to you about rehabilitation of muscle chains and M.P.R. di Rocca, a winner integration. Over the years, many authors have proposed different postural rehabilitation methods. For example, Mézières, Denise Struif, Myers, and others. Each of the authors has divided the muscle chains on theoretical base and functional models. In this slide, we can see, for example, the models of Mézières methods. But therapeutic sessions are long and expensive for the therapist and for the patient, with treatments that need many sessions and continuous reminders to maintain the benefits. For example, with the Mézières method, a session of Mézières can last 15 minutes for many weeks. But by applying the M.P.R. treatment protocol and programming the receptors of the tonic postural system, the muscle chains react in faster times and with lasting result over time. Here we can see the tension and stretching the fascia from the anterior lateral line, right? And here we can see the reprogramming of extraocular muscle to release the tension in the neck, in the upper trapezius and scom. Muscle chains represent circuits in continuity of direction and plan to which the organizing forces of the body propagate. They have the task of coordinating the balance in the upright posture economically and without pain. This coordination passes through the fascia. It is the envelope of the body. Every connective structure of mesodermal origin, sheaths, periosteum, tendons, ligaments, is part of it. This penetrates deeply into the fabric structure up to the cell lining. Any form of elongation is subject to the intervention of the fascial canvas. Therefore, it is essential that the sum of the applied tension remain in the physiological constant. Otherwise, the subject would risk provoking reflex muscular tension, which would lead to compensation. The function of the band are
Recording in progress.
protect the muscle and viscera it surrounds. It is involved in the balance of both blood and lymphatic fluids. It influences the nervous functions, both because the nerves pass through it and because it forms protected envelopes around them. So much so that adjacent to the nerves, we find the organs of Golgi, neuromuscular spindles, corpuscles of Ruffini and Pacini. In addition to the important mechanical connection, these chains are also connected by a central nervous scheme that maintains a basic muscle tone. We can see this. We can therefore define muscle chains as a defined sequence of muscles, the continuity of which is given by the fascial connective system, within which a preferential tone is maintained thanks to the activity of the central nervous system. Precisely, this tone is conditioned by the state of health of the main receptor of the postural tonic system, especially eye and foot, which are often found in dysfunction due to disturbing elements, in particular the chewing system, surgical scars, food hypersensitivity. With the M.P.R. di Rocca, it is possible to deprogram these dysfunctional receptors and, with relative simplicity, to deprogram and reprogram the patient's hyperactive muscle chains. In 10 years of professional activity, my patients have obtained great benefits from these treatments, since only by treatment the body as a whole can we find the right path for continuous health over time. In this photo, we can see the reprogramming, the chain posterior muscle, and in this, the deprogramming lateral line posterior. We can do deprogramming and reprogramming muscles and muscle chains. Between, we need to deprogramming the receptor of the posture. For this reason, we have created a master in postural functional rehab. Thank you for your attention. Send your question in my email, and I will be happy to respond to you. For more information, you can visit our sites. And again, thank you for your attention.
Yes, thank you so much, sir.
Okay, I hope you can see the video well. Okay, the video was and if I can answer any question if they want. There's some question I can answer if they have. If it's not, thank you for your invitation, and I will see you, I hope, in the next Congress presentially.
Yes. Yes. Any questions further? Any questions? Yes. Thank you so much, sir.
Thank you.
Again, there is no questions from our audience as well from the participants.
Thank you so much, and see you in the next meeting. Okay. Bye,
Yes,
everybody.
yes.
Bye.
Yes, definitely we will see you.
I hope the next time we see you presentially. Okay. All right.
Yes, definitely.
Bye, sir. Bye.
Yeah, bye. Next, we will have Dr. Daritri Hombadi, clinical physiotherapist from